Hello, my study buddies. Welcome to GrowMed. This channel is a one-stop guide for the Fmge aspirants. Here, you will find everything you need to the Fmge, like the mnemonics, then the previous year questions, image-based question, must-do topics, everything. So all you need to do is to subscribe to GrowMed and tap the bell icon so that whenever I post a video, you will get a notification. So join with me to ace this exam. So let's get started. In this video, I will be sharing with you guys the must-do topic for the surgery. So this is a part 2 video. I have already uploaded a part 1 video in which I have discussed certain important topics from the general surgery, then the systemic surgery like the breast, the thyroid, then the esophageal disorders. Watch that video also to get the idea of the questions and the type of questions asked from the topics. So in this video, the remaining topics which I couldn't cover in that video, I will be trying to cover those points in this video. So the intestinal obstruction. So intestinal obstruction, it is different like the small intestine and the large intestine. The causative organisms are different. Like for small intestine, it is due to the adhesions, formation of the adhesions. And whereas for the large intestine, it is usually due to the formation of the tumor. So usually this clinical features will be same, like the patient will be having distended abdomen and a pain and he is not able to pass the stools. Okay. But the causative factors will vary in the small intestine and in the large intestine. So questions are also asked on the management. So for the small intestine, it is the adhesiolysis, and for the large intestine it is removal of the tumor. Okay, then moving on to inflammatory bowel disease. This is also a must do topic because it is asked in relation with the pathology, the medicine, or the surgery. Okay, so look at the microscopic features, also the clinical features and what type of surgery you will be doing it. So inflammatory bowel disease, there are usually two types. So the Crohn's disease and the ulcerative colitis. So the features differentiating it, the Crohn's disease, it can affect any part of the GIT, but the ulcerative colitis, it usually affects the rectum. So starts from the rectum and spreads to retrograde to other organs. The Crohn's disease, it involves all the layers of the GIT, whereas the ulcerative colitis, it only involves the superficial layers. Okay, so there are also another very differentiating factors present, so you need to look at them and along with the images. Then moving on to the anal fistula. So questions are repeatedly asked. The one-liner, very famous one-liner asked is the investigation of choice, and it is the MRI. So you need to also look at the types, that is the intersphincter, transsphincter, supra or extra. Okay, and the pathophysiology is that it is due to the infection of the crypts of Morgagni which are present in the rectum. And another very important thing which you must remember from this is the Kutzal's rule. So it states that the anteriorly located, so if this is a rectum and this is the divided into the two parts, the anterior and the posterior. So it states that the anterior opens into a straight path like this, but the posterior, wherever it is, it opens in the midline. Okay, so image based question can also be asked on this. So do look at the images and also this rule, that is the Kutzal's rule. Then from this fistula anal canal, the question can be asked also on the anal cancer. So look at the points, the stages of the anal cancer, and along with that the stepwise management, and also fissure in ano. That means there is the fissure formed. So I also missed a few points in this, that few topics like the hemorrhoid and the anorectal abscess. Okay, so you need to look at these points also because hemorrhoid also, it is an important topic. So you need to look at the classification, that is the types, that is the internal hemorrhoids and the external hemorrhoid, and also you need to look at the management. So the management is so the classification, it is classified into four grades: primary, secondary, tertiary, and quaternary. So in tertiary, there will be primary, there will be only bleeding present, but in tertiary, in secondary, there will be bleeding plus prolapse. In third, there will be bleed plus prolapse with manual reposition, and in the fourth there will be permanent prolapse. So based on these stages, classes provided, you need to choose the management. So the next topic, the anorectal abscess. So usually question is asked on its management, that how do you manage the patient, and it is usually by antibiotics or cruciate shape incision. So these were some points, some topics which you must cover from the rectum and the anal canal. Then moving on to the system, a genitourinary system. So from that, a very very important is the kidney stones. So the types of the kidney stones, their composition, their classification, their structure, how do they look, all these things you must study, and you must read the management of the kidney stones. So the method, that is the ESWL, PCNL. So when we'll be doing it, what is the criteria for doing this management? Okay, so based on the size and the type of the kidney stone, we will be usually treating the patient. So a clinical case can be asked that a patient with symptoms of the kidney stone like the flank pain, okay, then, and they'll be describing that the pain is radiating to some location, and uh, the investigation was performed and the investigation finding can be given, and they will ask you the management. Okay, so do look at the features which are described in the question and mark the answer according to it. Then another very important topic is the polycystic kidney disease, autosomal dominant and autosomal recessive. Dominant means usually seen in the adults and recessive in the pediatric patient. Then medullary sponge disease, its images, its clinical features, then how do you treat it, everything. Then urethral injuries. So usually questions are asked on this, that a patient had undergone a road traffic accident or had fallen in a pat hole and there is bleeding, blood seen at the meatus, or there is blood filled in the pouch, in the superficial perineal pouch. So which part of the urethra is damaged? Okay, so like that you need to look at all the points, the parts of the urethra, that is the membranous part, then the prostatic part. Okay, and when there is injury, what kind of features, what kind of clinical features the patient can present with. Then moving on, the hydronephrosis. So due to the pathway obstruction present in the pathway, so the obstruction can be mainly in the ureter or somewhere in the bladder, due to which the urine is not able to pass and it will collect in the kidney, causing hydronephrosis. So image based question is asked on this hydronephrosis. Usually it looks like this is the kidney, the ureter is dilated like this, somewhat dilated like this. So by looking at that, you will be able to find it as the hydronephrosis. Then moving on to the next important topic, that is the prostate, benign prostatic hyperplasia. So it is also a very famous question and favorite topic of the FMGEs. So usually question is asked mainly on the treatment, symptomatic treatment or permanent treatment, and it is also asked in relation with the pharmacology. That is, we will be usually giving the drugs, that is the five 5 alpha reductase inhibitors like the dutasteride and the finasteride, and for the symptomatic relief alpha blockers are used, which are the terajocin and the doxazocin, the drugs ending with the jocin. Okay, so this was about the benign prostatic hyperplasia. So question are also asked on that location, from where does it arise. So another very important point which you must cover from this BPH from the prostate is the prostate cancer. So this also, it is asked in a form of a clinical case, an elderly male, and he is also having urine retention problem with the urination and back pain, lower back pain. So what will be the cause? It will be the prostate cancer. Then moving on, ectopic testes. So testes is not present in its usual location. Okay, so it can present anywhere in the pelvis, and usually questions are asked like a 1 year old child or some 6 months old child, his mother has brought the child to you that she's not able to palpate the testes in the scrotum. So what is the diagnosis? So it is the ectopic testes. So it is very easy to solve some questions based on their uh, clinical features itself, like, and also the questions are repeatedly asked in the same format. The pattern of the question is same like the ectopic testes. Likewise, the undescended testes also, the format is same, like a 1 year or a 6 month old child, and he comes, his parents bring to you, and when you palpate the scrotum, it is empty, and when you palpate the abdomen, you find a mass in the abdomen. So what is the diagnosis? So it will be undescended testes. Okay, so as much as you practice the MCQs, you will be able to solve the questions clearly, because you will be understanding the concept, and you will also develop the art of solving the MCQ. Like this is given in the question, so it can be the answer like that. Okay, and mainly if you practice the previous year questions, so you can also come to know the pattern of the question. Like if the same pattern of the question is given, then you will be easily able to solve that question, that this was asked in the past, so this will be the answer. Then moving on to the torsion of the testis. This is also an important topic, because clinical case can be asked or image based question also can be asked. So torsion of the testis, it is usually due to the bell clamp deformity, and the testis rotates, and whenever there is rotates, there will be pain. So out of proportion pain, the patient is crying in pain. Okay, so By these features, you will be easily able to identify it as testis torsion. Then varicocele, also quite easy topic. So the varicocele, it is due to the dilated pampiniform plexus, and due to which there will be swelling present, and in the question, a piece of a cake can be given that bag of worm appearance. Bag of worm. So whenever you find this word bag of worm appearance, straight away go with the varicocele. So this is a piece of a cake to you guys, and if this is given in the question, so the examiner is also giving you the answer that it is the varicocele. Then investigation of choice, it is the Doppler, as the blood vessels are involved in it. Okay, so the venous system is involved. And also look at the management, how will you manage this patient. Then moving on, spermatocele. Likewise, there is another topic that is the hydrocele. So it is due to the fluid collection in the testes, between the testis and the tunica vaginalis, and it can be primary or secondary. And the spermatocele, the question asked repeatedly is the three testicle appearance. It is seen with the spermatocele. So whenever this thing is given in the question, go with the spermatocele. So this is also a piece of a cake to you guys. Then moving on, cancer of all the organs. So how many organs you will be studying in the surgery? The esophagus, the starting from the oral cavity. Okay, so oral cavity, then esophagus, then GIT, stomach, intestine, small intestine, then uh, pancreas, pancreatic cancer, then the bladder, kidney, everything, all the organs you need to look at the cancer. So this topic becomes very wide, and it is very vast. So the thing you need to remember from this is the TNM classification. So the TNM classification is a hectic and very time consuming also. So try to break it in various stages, like just remember the main thing, that stages, how many stages are there. So stage 1, then they're again classified into the A, B, C. So you will not be also able to remember these much in detail because you have to read a lot. So it is better that stage 1, it is like involvement of one layer. Then stage 2, it is involvement of two layer. Then in stage 3, there is involvement of the lymph node, something like this. Make tricks or make mnemonics to remember it, and try to make it short. And along with that, also look at the management, because if it is layer 1, then it will be just a superficial treatment. Okay, so removal of the one layer or removal of only that part. Then if it is then involvement of the lymph nodes, then you need to remove the lymph nodes also. Like for example, if it is the kidney, then it is usually based on the size. Like if it is less than 4 centimeter, then there is different management. If there, it is more than 7, then we will be doing the radical nephrectomy. If it is 4, then it will be partial. So just go through these points and look at the questions, which type of questions are asked, and make a separate table or a chart type of thing for these cancers, and try to revise them 2-3 times. Then moving on to the next important thing, that is the instruments. So usually image based questions are asked on the instrument or its uses. So they will give an image and ask you what is the instrument, or giving the image what is the use of the instrument. So do look at the instruments also. So because I have seen one question in almost all the papers of the FMGE based on this instrument. Okay, so this was the list of the important topics which you must do from the surgery. So surgery is a very big subject, like I mean a huge subject. So if you try to sit and read everything, all this, then the 4 or 5 months will be needed to complete it. So it is better to try do it in a smart way by looking at these points and which type of question is asked, break it into different parts and try to cover it. So that's it in this video, guys. I hope this video will be useful to you all. Thank you so much for watching this video, and good luck for your FMGE journey. Thank you so much. Bye bye.